So now that you know all the anatomy of the temporal bone, we're going to look at the pathology. So this is, I normally have about 4 hours of temporal bone pathology that I go through. So I've picked out a couple of areas where there are important differentials for us, both on the clinical presentation and on the imaging side, and we're going to focus on those areas as we go through the temporal bone. So we kind of can start from the outside and go in. I'm going to skip the external auditory canal in terms of its differential, and we'll look at a couple of areas where they're very important, both clinical presentation and imaging differentials in the temporal bone itself. I was talking to somebody this morning about CT and MR again, so I put in these videos. So this is the CT scanner rotating around when it's open. And again, we want to remember this is a big, stupid densometer. You see that big hole in the middle, that's why we have that thing closed, so that we're asking the patient to put part of their body in there. But it's very different than MR. We had an MR scanner that we were trying to sell, and we ended up taking it apart. So before we did, we threw stuff in it and videoed it for what we could. So things we use all the time, like scissors. Here's some scissors bouncing back and forth through the MRI scanner. This is a plumber's wrench. We went and got some 2x4s. The important thing here is that the MRI scanners are extremely dangerous. Why is that important? Well, there's a lot of stuff we use, like stethoscopes. You bring those in the MRI scanner, they'll get pulled in there. Here's again another pair of scissors, just if they forget they're in your pocket. You know, the patient's in the bore there. You see how they go back and forth? That reminds us of the field going through the middle and kind of around the outside. So things bounce back and forth through the middle.